here we are. This is Sex Love Psychedelics, and I'm your host, Dr. Kat. Bringing you psychosexual conversations that will leave you intellectually turned on and hungry for more.
I don't think this is talked about enough around the impact of stress or chronic stress or even trauma that might be impacting the fertility or this in my sex therapy practice I've seen where sex becomes this like job and then there's all this pressure on them and they can't conceive a baby because they're just so stressed and they're not having fun enjoying sex anymore.
100%. And I think that's one of the biggest issues that couples experience. In fact, it's something that I see so often where people are literally asking their clinician in my clinic, like, do we really have to have sex? I'm like, okay, let's just go back to biology 101. Yes, you do. And it becomes this really, instead of what sex usually should be, which
Mm.
is enjoyment and intimacy and connection, it really becomes this chore. Most men end up having, erectile dysfunction or ejaculatory issues because they're like, oh my God, this is too much stress. Because then the woman goes, all right, it's on. We've got to do this now. And like, how is that going to make a man feel? This is one place where I really do feel for them. It's like, okay, let's just like take this several notches down, ladies. Kind of like do like go dress up and be sexy and do the thing so that they actually feel enticed into this event as opposed to it just being like, come perform, get out, let's just go to sleep. It's like,
Yeah,
oh my God.
where's the creativity? Where's the eroticism? Where's the sensuality? The pleasure of it? It's all like purpose. Yeah.
And look, and I think that that's also, it's something really important to speak to, is the fact that women need to understand that, and it's a biological overtake, right? Which when a woman wants to have a baby, oh my God, like it is all she will think about, talk about, research. It's like, don't get out of my way, right? And she wa- when a woman wants to be pregnant, she wants to be pregnant right now. She wants to be holding her second baby in this moment. Even the 9 months that you have to wait to be able to do this is too long, you know?
Yeah.
Like that's the kind of feeling. And it's interesting because I had been working for about 10 years when I saw all of this play out, like women kind of just be so, I want to have a baby and I want to have a baby now. And I kind of thought, gosh, that's just a bit much, like is that really like how is that like I don't know. Until I then decided that I wanted to start trying to have a baby. And then I was like, okay, now I understand.
hmm
There's a switch in your brain that kind of goes like, okay, now is the time, like just get this done, right? And so, and I was very lucky because I knew I had been diagnosed with polycystic ovarian syndrome, which is irregular cycles and number one cause of infertility in women of the reproductive age. 15% of the population experiences PCOS symptoms, which ovulation becomes, problematic and so on. And I had the wonderful privilege of a gynecologist tell me that you have polycystic ovarian disease over the phone
Oh
when I
God.
was 18. And I'm thinking, am I going to die? Like, is this like really serious? And I actually said to him, I said, is this really serious? And he goes, oh, no, no, you're probably just never going to have children.
Shut the fuck up. Oh
In that way, right?
my
Literally, those were his words. And I kind of went like, in that moment, in that split second, I go, okay, no children. That means I'll just focus on my career and I'll have a great life anyway. Like, literally, that was like, I didn't even think about it, right?
Yeah, yeah.
But looking back, I see that it really has shaped my
Yep.
work,
hmm
where I decided to start working in and, everything that I did. And so when I met my husband, I said to him, I said, listen, there's a possibility that I'll never be able to have children. Do you need to know this? So you need to know whether this is something that is a deal breaker for you or not. He was like, no, that's fine. I'll figure it out as we go along. Okay. So then about 3 years, 2 to 3 years before I started thinking that I might want to do
Mm-hmm.
something in terms of having a baby, I started treating myself, right? So I started, sorry, just a little cough.
Mm-hmm.
I started treating myself and I started to do the things that essentially, like I joined my own program, my own fertility program. And I also made him have a semen analysis. And we also realized that there was some morphology issues, like shape of the sperm was problematic. We needed to improve that. We could improve sperm parameters, so we both started being treated. So that when I actually decided to start trying, we actually conceived first try. So
Mm-hmm.
it was very non-eventful, right? But
Mm-hmm.
simply because I had already been doing all of the work to
Yeah.
get to the point where it would be easy, right?
Yeah.
Then I had my first son. And I breastfed for like 2 years, and my periods didn't come back for another 15 months
Mm-hmm.
after breastfeeding, because that's also one of the things that happens in PCOS. Your cycles become irregular when prolactin elevates because of breastfeeding. You then have, like more irregular cycles.
Mm-hmm.
And so by the time I decided, it was about 17 months into breastfeeding that I started thinking, I want to be pregnant again. I want to have another baby.
Mm-hmm.
And then it was the point where I was like, from 17 months in to the next 17 months that it took for me to actually be able to have regular cycles again, to start trying, that was one of the most stressful periods for me, that I consciously had to be thinking about, relax, it's okay. You're
Mm-hmm.
not quite ready yet. Your cycles haven't yet returned. So there's no point in putting pressure on yourself that this is. So I
Mm-hmm.
literally had to like talk myself into clarity and understanding, and
Mm-hmm.
and so by the time my cycles started to regulate, which was
Mm-hmm.
about 30, 34 months into the whole thing after giving birth. I tried the first cycle and I had a negative pregnancy test.
Mm-hmm.
And at that point, I was like, okay, now I understand what my patients feel for years, because it was just, and it was just one negative pregnancy test. But I actually had to make a decision and kind of have a deep sit down conversation with myself to go, okay, what's going to happen if you're not pregnant in the next 12 cycles? At what point? Because I'm the kind of person that I like to have direction,
Mm-hmm.
So I had to kind of like have a conversation with myself and decide, what does this mean?
Mm-hmm.
And how much am I willing to do?
Well, that was fun. Thanks for tuning in, lovers. And if you want to experience more ecstasy and sexual liberation, head over to sexlovepsychedelics.com and learn about how you can join me for any one of my online or live events. And while you're there, grab my free guide on sex and psychedelics. Remember, this podcast is for entertainment and educational purposes only. Please contact your healthcare provider and local law before pursuing any of the products or psychedelics discussed. And one final note here. I make this show specifically for you. If you're loving the show, then be sure to leave me a review in iTunes or Spotify to let me know. Happy to be here and happy to serve. I'll see you next time on Sex, Love, Psychedelics.